don't know if we are really deeply involved in policy making as such, but we support policymakers with evidence. So I just would like to make this remark. And thanks a lot for the opportunity to talk to you this afternoon. European Center for Disease Prevention and Control has been mentioned several times by Professor Brandt. Thank you for the helicopter overview. So it makes my task a little bit easier. It's a European Union agency established 11 years ago. And we have, in our structure, we have a commission, of course, as main key stakeholder, but we also have member states, European Union member states, and European Economic Area countries. And we have a management board, which is with representatives of all the member states. And actually, I'm very pleased to say that the chair of the management board is here in this room. It's Daniel Reinders from Belgium. And we also have advisory forum, which is a body of the center that provides scientific advice to our products and our work plans. As mentioned, there are quite a lot of key stakeholders and players in the area of health. Last but not least, I would like to mention the World Health Organization that has a very key role in dealing with public health issues. And when we talk about global epidemic threats, which was one of the aims of this meeting here as it was listed, how do the EU tackle the global epidemic threats? I'll try to give you a bit of an overview. I mean, this could be a talk of a whole day, so I'll try to be quite brief, and then, of course, we will take questions with Professor Brandt. So, in principle, what the public health should be prepared for naturally occurring outbreaks, like pandemic, influenza, or vector-borne diseases, or antimicrobial resistance issues, so that we need to quickly recognize the disease, to control the spread of it as much as possible through different means, to assure that people would get the needed care, and this is the healthcare systems. And then to coordinate and with the national and within the country and with international agencies the measures, and to prevent, if possible, a mass panic. And public health is also linked with other events that are not caused by biological threats, which are earthquakes, floods, and radionuclear incidents, and like climate changes and climate conditions, as already mentioned. In our mandate as an agency, we have a focus on risk assessment, and as mentioned by Professor Brandt, risk management is in the hands of the member states, which is important to remember this division, because we may provide advice, we may provide guidance, but the measures taken are in the hands of the national authorities in the member states. However, the coordination between the member states when it comes to cross-border health threats is very important. We are working predominantly with the European Union member states and European Economic Area countries. However, we have a very close collaboration also with the enlargement countries and with the countries from the European Neighbourhood Policy area. And this is important because, as mentioned, diseases do not respect borders, so and we have a lot of movement of people, and it's important to coordinate with authorities and with the communities on the measures that and assessment of risks that we do for the infectious diseases. As mentioned, the policy context of public health is quite complex. However, we are trying really and our focus is infectious diseases in our mandate. So we try to respond to requests of member states. We have so-called national focal points for different diseases and for preparedness and response in the member states. And we also have contact points in the enlargement countries and with the European neighborhood policy countries. We work quite a lot lately with the legal framework set up in 2013, which is the Decision 1082 on cross-border health threats. I will come back to this decision a little bit later. We also work in the context of international health regulations, and I would like to mention the latest developments in the disaster risk reduction also involve quite a lot of issues on health. There was a Bangkok conference and Sendai conference a few years ago where issues of health have been really highlighted, and now there is quite a lot of work in the area so that health is much more visible also in the area of disaster risk reduction. Decision 1082 on cross-border health threats, that has been really kind of, there has been a lot of work in preparatory phase to set up this decision. And the main elements of the decision is that core capacities and in preparedness and response planning at the national level should be strengthened. And that, of course, should be done in accordance with international health regulations. There should be a good collaboration and interoperability of plans between different sectors. Here we mean health sector and, let's say, civil protection or environmental sector or transport sector. The different sectors also should collaborate in working on business continuity plans when there is an epidemic, what will happen with the different sectors. And pandemic preparedness, for example, is also one thing that is quite high in the agenda and has been, we had a lot of work in the past 10 years in that area. When we talk about public health emergency preparedness, there are different definitions, and you will get the slides, so I will not read word by word. But again, what is important is that we have a good preparedness plans that are developed, that we have trained staff and trained communities how to react if there is an emergency, and also that the plans are tested and evaluated regularly. And this is important. So we, in our agency, we developed an idea for, it's not new, but we just worked on it, on a preparedness cycle. So we have several phases, and we take anticipation, response, and recovery as major phases of the cycle. And within this, we try to work on areas to identify risks, because it's risk assessment is our, as I said, our main task as an agency. Then we try to develop some guidance on how to prioritize risks and identify those risks in details. And then if there is an event, then we should develop a strategies how to respond to this event, how to minimize the damages. And then later on, we try to evaluate or provide guidance on how to evaluate and how to bring back to the planning lessons learned from the different threats. The agency has long-term planning, and these are the strategic objectives that we set up a few years ago, so that we evaluate and we support the member states to evaluate public health emergency preparedness plans so that they address their gaps and needs. We try to develop tools and support the implementation of Decision 1082 on cross-border health threats. And then we also, as an agency at the EU level, we try to promote exchange of knowledge and good practices, and also provide capacity building for the member states, which means training, support, simulation exercises, critical incidents review meetings, and so on. we have a section in the agency. Well, we work in several areas. We have surveillance, we have response, we have preparedness. Where I belong to, we have scientific advice, and we also have activities in communication. In preparedness, we have a section on country preparedness support that was established quite very much in line with the legal framework that I mentioned. So there, as I said, based on this preparedness cycle, we try to identify good practices, and we do this through literature reviews and different case studies, which means we take a disease like, let's say, polio or MERS coronavirus, and then we try to test and see how countries would be prepared, what are their plans, what is the collaboration with other sectors. Then we also try to develop different tools on, let's say, simulation exercises, supporting the member states in their work on after action or critical incidents reviews. And then we organize meetings and workshops on to exchange good practices and share experiences. We also have training. We have a training section. And we provide also upon request of the member states some training courses, and we also try to be involved with academia so that we collaborate and also have the up-to-date knowledge on preparedness and response issues. And then, yeah, there are several phases when you talk about health security issues, and of course preparedness is a phase before you have a real event, but sometimes you have an event and then you still try to revise some of the plans. And that was the case with Ebola, and I will come back to that in a minute. When we talk about planning phase, we produce some technical reports and some guidance, handbook on how to plan or how to prepare your system for some threats. And you can find most of this on our website. And I have links at the end of the presentation, so I hope I try to reflect most of our publications. There were 3 countries that we visited, and we used MERS coronavirus as a case study to work on pandemic preparedness. But there was also a lot of work in 2006 and 2007 on pandemic preparedness planning, and this has been published. And many member states after the pandemic 2009, revised their plans, and this also has been now updated on our website. And we started now working again with the member states on pandemic preparedness planning. And it's important because as most of the member states have these plans, we try to see if these plans are also valid as generic preparedness plan. So that it contains the most important elements for any plan for emergency preparedness. So we visited 3 countries, so you could see the report, the aggregated report on these case studies. One report on polio preparedness will also be published next week. For 2 countries, we don't have polio in the EU, but there are some threats, so we use this case to evaluate again, to work with the member states to assess their preparedness. There is, now we are working on a guidance on strategic preparedness, planning for public health emergency preparedness, which publication hopefully will be available sometime mid-next year. And I will not go into details here because you can find all this in the website. When it comes to security issues and when you have a threat, for example, like it was with Ebola, you need also to have a good protection for the healthcare personnel and also for the other sectors that work. For example, in the airports, sometimes it may be that people would need some specific protective equipment to work if there is a specific threat. So we produced the guidance, and we worked a lot with the member states in that area. And joint procurement mechanism that was mentioned by Professor Brandt is also one tool for the member states to ensure that they have sufficient equipment at hand if there will be a threat. We also have we work a lot on stimulating the member states to test their plans, and this is mostly through simulation exercises. So we have a handbook, and many member states have done simulation exercises. Some experienced a kind of real threats lately with some outbreaks. So this is also a way of testing. But for major threats, we hope not to have them in the EU, but it's good to have simulation exercises and to test the plans. Yeah, as I mentioned, there were some assessments, and for Ebola, we visited 3 member states. It was about the plans on preparedness, but it happened during a situation of a threat, so it was kind of combination of response and preparedness. Nevertheless, we had a very good review of these member states, and we have published, of course, with their agreement, the reports, which you could find on the website as well. Yeah, this is just saying again of the different reports. What I would like to mention is that now for next year we asked our colleagues in the member states what would be the interesting topics to work and useful topics to work with them. And it's not only our idea to work on simulation exercises. Actually, we had quite a few requests from our key stakeholders to work together on sharing good practices on training and simulation exercises. And one area that we would like also to focus more, and I'm glad to hear about the project on data cooperatives, but we would like also to work in the area of community preparedness, because it's important that communities in the member states also at least have discussions on what is preparedness and how the communities work together in the area of public health threats. There were several events after the Ebola, and Professor Brandt already mentioned, with lessons learned, exchanging ideas on what countries did and what they didn't, or what they think they could do better. These are published reports. One that is missing here is the report on implementation of the cross-border health threat, which was published by the European Commission last year. And this legal act actually require, based on this legal act, member states are required to report every 3 years on their preparedness plans and their activities in preparedness. So next reporting period is next year, and it's very much also in collaboration with the World Health Organization and their work on international health regulations. As you would see, lessons learned from different events that were organized both at the EU level and in the member state level reflect the collaboration between the different sectors, availability and feasibility of emergency plans, and then how what we have learned then goes back to the planning phase of our work. And this is important. I think we should go back and test and prepare and go back again into planning in order to improve. And the end of the slides are links to different documents, so I hope they will be useful for you. Thank you for the attention.